want to provide some perspective and insights as to how top health officials are dealing with this outbreak. We are joined by KPIX 5 medical producer Molly McCrea, and obviously you're doing what so many are doing, working from home via Skype and talking with us. So good to see you. I wish it was in person. But let's start first things first. What are the experts saying about this need for this unprecedented shelter in place for the Bay Area? Obviously a clear health reason.
Oh, Alan and Juliet, we are seeing so many in every single county in the Bay Area. We are seeing community spread. And this is before we've done any kind of mass attempt at screening people for COVID-19. So that means since it's out there in the community, we have to shelter in place because we really don't want to be like Northern Italy at this point. We want to keep this infection at lower rates. You know, you've heard this whole thing about flattening the curve. That's what we want to do because we don't want to overwhelm our hospitals and we don't want to overwhelm our healthcare workers.
Yeah, I think you and I were chatting earlier. It's really the responsibility of people who are even healthy to stay in, to spare those who may contract the virus. And so it's our duty to do that.
Oh, you know, there are a lot of young people that are walking around the Bay Area right now, or they may be at home, they may be watching this broadcast at this point thinking that they're healthy and they have nothing to worry about. So why should they have to shelter in place? The point being that you can be asymptomatic and still be carrying the infection. And so that's why you have to heed and take care of your neighbors and people around you.
And I think it's important to note for everyone's sanity, though, what are the guidelines? You can still go outside and get fresh air. You just keep that distance.
Yeah, 6 feet. 6 feet is the new normal, right? Just make sure that you've got social distancing around you. If you go out and walk your dog and you want to take, let's say, your son or daughter with you, everyone should maintain the 6 feet, except for the dog, of course.
Of course. Obviously, the big question, where do we stand on testing? So what have you been reading up on that so far?
Well, you know, we're lucky because we have a lab, we have a company right in our own backyard who will be producing 1.5 million tests, hopefully within a month. But the concern here is that there may be some issues with supply chain materials. A lot of these tests depend upon equipment and chemicals in order to run them. So if not just everybody is going to be able to demand a test, there will still be some sort of a triage in terms of who should get precedence. And in one big way, healthcare workers really need to know what they're dealing with when someone comes into their hospital and needs care. So I have a feeling that it's going to be, and from what I'm hearing from the experts, it's those who really have symptoms and they really need to know if this person is COVID-19 positive or not.
Well, Molly, you've been our medical expert and producer, so we'll be checking back with you during these times for sure. So thank you so much, and I can't wait to see you in person. All right, Molly
You're very
McCrea.
welcome.
Thank you.